Everybody has heard of it. You might know it by a different name. Most people have a story, either of their own or somebody they know who has it. So, what is it? Bipolar disorder is sometimes called manic depression. And now that you know what I'm talking about, you can figure out exactly what I meant. Who do you know that has this potentially debilitating disorder? Or was it your own story that came to mind? Just like our cryptic opening, bipolar disorder can be an elusive and hard to describe problem that everybody seems to know about, but very few people can define. We are here to answer some of the questions you might have about this enigmatic condition and give you the facts that you probably didn't know. Don't forget to give us that thumbs up if you find value in our content. Also, please share these videos to spread awareness about the important mental health topics that we discuss here. And finally, you can become a subscriber and keep up with every single one of our videos so that you get the most up-to-date information that we have to share with you. Often, even those who have been diagnosed with bipolar disorder cannot strictly define their own symptoms because the manic nature of the condition keeps its victims from being able to articulate exactly what they're feeling during or after the swings. Well, we'll give you the facts so that you don't have to guess or wonder what bipolar disorder really is, no matter what you've heard. You can also check out our sources for yourself to get a better picture from the professionals who we trust to get our facts straight. According to the Mayo Clinic, bipolar disorder is a mental health condition that causes extreme mood swings that include emotional highs, called mania or hypomania, depending on the severity, and depressive lows. It used to be called manic depression, which is a clinically accurate term, but doesn't go far enough to define the causes and symptoms together. It was redefined as bipolar disorder to both remove it from the category of depressive disorders and to more accurately reflect the bipolar nature of the actual disorder. Episodes of mood swings may occur very rarely, particularly with proper psychiatric treatment, or they may occur multiple times in a year. These can be mild events that are difficult to discern from normal everyday behavior and only truly affect the person who is suffering through them. On the opposite end, these can be massive outbursts that are difficult to ignore and can bring a relatively normal life to a screeching halt. Mania is the term used to describe the high part of the swing. Hypomania is a lesser degree of the same thing. A person with bipolar disorder can have both manic and hypomanic episodes, but the difference is very noticeable, particularly to the person going through it. The similar symptoms of mania and hypomania include these things. In order to be diagnosed with bipolar disorder, you must have 5 or more of these symptoms to any degree of severity. All of these symptoms, taken alone, are things that any one of us might find ourselves doing while stressed out or nervous. The combination of multiple symptoms taking place at the same time is what defines mania, if more severe, or hypomania, if less severe. Depressive episodes, the low part of the swing, can be major or minor. A major depressive episode includes symptoms that are severe enough to cause noticeable difficulty in everyday activities, such as work, school, social activities, or relationships. Anything less would be a minor episode. Here are some of the most clear symptoms of a depressive episode. A depressed mood, which is defined as feeling sad, empty, hopeless, or tearful. In children and teens, a depressed mood can appear as irritability. A marked loss of interest or feeling no pleasure in all or nearly all activities. Any significant weight loss when not intentionally dieting. Any significant weight gain. Any significant decrease in appetite. What defines a depressive episode of bipolar disorder is any 3 of these symptoms taking place at the same time, particularly in combination with the 5 or more symptoms of a manic or hypomanic episode immediately preceding or following the depressive symptoms. Now that we've laid out some terms and definitions, let's discuss what bipolar disorder is in a diagnostic sense. When diagnosing bipolar disorder, a psychotherapist would typically try to find a treatment that fits the exact symptoms and severity. From that desire to first do no harm, multiple subdiagnoses have arisen. There are 4 major categories of bipolar disorder. Bipolar I disorder is the most severe, defined by having at least one manic episode that may be preceded or followed by hypomanic or major depressive episodes. In some cases, a manic episode may trigger a break from reality, also known as psychosis. Bipolar 2 disorder is defined by having at least one major depressive episode and at least one hypomanic episode. In this case, no manic episodes have taken place. Cyclothymic disorder is a rarer form of bipolar disorder that typically starts in the teenage years. It is defined by having at least 2 years with many periods of depressive symptoms or 1 year if in childhood. All other types include, for example, bipolar-related disorders induced by certain drugs and/or alcohol. This fourth category also includes disorders brought on by medical conditions such as Cushing's disease, multiple sclerosis, or stroke. To complicate the diagnostic problems further, the frequency of symptoms can mask a manic cycle. What would at first appear as a swing from high to low if described back to back might look unrelated if separated by a couple of months of relatively symptom-free life. This can be called mixed cycling. Likewise, if symptoms happen too close together, often called rapid cycling, it can be hard to diagnose bipolar disorder because the symptoms might appear unrelated as having multiple causes. This can also happen if the symptoms swing too quickly between manic and depressive, particularly when there are multiple triggers happening in a patient's life. When bipolar disorder happens in youth, it can be even harder to diagnose correctly because a certain amount of instability is already attributed to children and teenagers. Sometimes the symptoms are masked by what would otherwise be typical behavior. A skilled psychotherapist is needed to tell the difference. Here's a hard fact. Bipolar disorder does not get better on its own. With one of those 4 subdiagnoses we talked about before in place, a qualified psychotherapist can help to assign a treatment plan, which usually includes medication and intensive therapy. Another hard fact is that 3.3 million adults in the US have a bipolar disorder diagnosis. When taken as a reflection of the number of people who never seek treatment for mental illness, which is 65% of the population as we discussed in our last video, that means that there are a whole lot of people who suffer from this treatable disorder without any help at all. When you consider that suicidal thoughts and behavior are common among people with bipolar disorder, it becomes even more necessary to identify and seek help for those who suffer from this affliction. Usually, when the suicidal thoughts begin, other symptoms have already manifested. For those of you who know somebody directly, you are already a lifeline for them that they definitely need. All you have to do is to continue to be a friend, and don't forget to ask the question every so often, how are you? Remember that one of the key criteria for diagnosing bipolar disorder is symptoms that disrupt daily life. Have you known anyone who frequently leaves or misses work or school for some of those reasons? What you can do with that information is to just be supportive. You can encourage someone who might need help to seek it. It's not your responsibility to diagnose or challenge the person, no matter what your intention. All you can do is try to help. You can call the National Suicide Prevention Line by dialing 988. You can also text your message, whatever it is, to 988. What are the things that you knew about bipolar disorder before this? We always want to bring you important information on mental health. Let us know down in the comments if you learned anything new here today. Please give us a like if you found some value from this video, and follow our channel to keep up with our pertinent, relevant mental health information.